And it looks like I am not in control. So
I have you.
hopefully
Just let me know next screen.
Hopefully Kara's gonna get this through for us here. So our objectives are to gain an understanding of the least restrictive environment, which is referred to as LRE, or referred to as a change of placement, and to discover the continuum of non-traditional placements that are available to students. And we're going to learn about procedural safeguards and the considerations for the IEP during a change of placement or when we make a change to the least restrictive environment. Go ahead, Kara. So the least restrictive environment is part of the Individuals with Disabilities Education Act, referred to as the IDEA. And it says that children who receive special education should learn in the least restrictive environment, and this means that they should spend as much time as possible with peers who do not receive special education. So anytime we're going to look at changing that, we're changing their least restrictive environment. Go ahead, Kara. And I apologize, my yard maintenance people are here cutting my grass, and if you hear that in the background, sorry. They usually come on Wednesdays, but it rained yesterday. So the core of IDEA's LRE provisions talks about specific supplementary aid or service that's typically provided in a separate environment that's not in the regular education classroom. And is it necessary that it be provided outside of the regular ed classroom? Because oftentimes we find that kids can have that same service in the classroom, not be removed, and it could be a better placement for them to stay with their peers. So no, you don't have to change their placement just because they need a certain service. Obviously, some placements like residential or home instruction you can't do in the regular ed classroom. But schools need to make services available in the least restrictive environment. Go ahead, Kara. So there is a continuum of services, and it starts off with the general education classroom, which is, our goal to just be like everybody else and our typical peers with no supports and no services. And it goes all the way through to residential services and everything in between. We can talk about inclusion, where, we might put another teacher, a special ed teacher in the classroom to help students that need help. We can talk about resource rooms. We can talk about self-contained classrooms within the regular school. But we also need to know about separate schools. We need to know about residential placements. We need to know about hospitals. We need to know about home instruction. Go ahead, Kara. So the non-traditional placements, I guess I already talked about those day treatment programs. So I think that's the one I didn't mention. That might be a place where somebody goes either for partial hospitalization or just an autism school or something where they are going there for the day and coming back home in the evenings. But again, all the way through a residential placement. Go ahead, Kara. So it would be remiss not to talk about district of residence and the district of service when we're talking about out-of-home placements or out of the regular school placement. So oftentimes our kids in Ohio end up in a different county or in a different school district. So the district of residence is the district where the parents live, where the student is from. And they're responsible for ensuring that an IEP is developed and implemented for all children that live in the district, including the ones that might temporarily live elsewhere. So they're mandated to cooperate with other districts, with county boards of DD, with other educational agencies that serve children with disabilities, that are in institutions or other care facilities, to ensure that these children have access to an education in the best setting that they can and what's appropriate and specified in the IEP. Then we have the district of service, which talks about the district where the service is actually being provided, which again, if you're in a different school district, you live in one place, but you're going to school somewhere else, that would be a district of service. And they're the ones that are actually responsible for providing that service. Go ahead, Kara. So we have considerations for changes to the IEP when we make changes to placement or to the least restrictive environment. And IEPs should be reviewed within 30 days of a placement change. So if we have a kiddo going into a separate facility, going into residential placement, starting home instruction, the school should review that IEP within 30 days and make any necessary changes. One of the most necessary changes is the change to the least restrictive environment. So some other examples of changes that could be made to the IEP, or at least changes to consider, are revisions to include the district of service. Any other, these are categories right on the IEP. So I'm calling off categories from the IEP. Other information could be changed to include any medications or anything that the school might feel is necessary. A profile, which might talk about why the child's being placed. Perhaps there are new goals that need to be had since that necessitated a change of placement or a residential location of service is going to be changed again to that same, residential placement or to a separate facility. Related services may need to be changed, the amount of time, the accommodations, updates to behavior plans or safety plans, and again, that update to the least restrictive environment. And really any other changes that the IEP team would feel is necessary to make sure that the child is getting whatever they need in their educational placement. Go ahead, Kara. So the least restrictive environment, this is exactly what it looks like on the form, and I thought it was important to share that you actually have to say, you have to answer these questions when you're going through the IEP. Does the child attend the school that they would attend if they're not disabled? And you have to mark yes or no. And does the child receive all their special education services with non-disabled peers? Again, yes or no. And if the answer is no, you have to justify it. It used to be that you just could mark no and kind of move on, but now there has to be a justification. You need to put in writing why you're changing their least restrictive environment. And oftentimes we see things like, due to intense behavioral concerns or the need for mental health treatment or any number of issues like that could be listed here to justify why we're moving somebody into a non-traditional placement. Go ahead, Kara. And anytime the LRE is changed, it requires the parent to sign off on it, that hasn't changed, but the way our IEPs look has changed. So now parents are more aware that they have the right to say no, or to say, I don't understand this, explain this to me more. So the signature page, if we could move to the next slide, Kara, I've shown you again what it looks like on the IEP. It's number 15, the IEP signatures. And if you'll see, that first line talks about an IEP annual review that's not a change of placement. And that's where a parent would sign if the placement was going to stay the same. And the parent has the right to agree or disagree and to talk about what they agree or don't agree with. But towards the bottom, there's an IEP review that is a change of placement. And the parent needs to mark that they either give consent for this change of placement or they do not give consent for the change of placement. And of course, they can always revoke consent for special education services. And then the parent needs to sign that. So that's a nice safeguard with our procedural safeguards to make sure that parents understand that they have a say in the placement. Oftentimes I see kids get moved to separate facilities or to more restrictive environments for a suspension or in lieu of an expulsion. And this is to kind of prevent that from happening. Go ahead, Kara. So LREs, the least restrictive environment, should be customized to a student's needs, and you should really explore your options and what that means. And so when we talk about, moving a kid to a more restrictive environment, sometimes that might mean that we shorten a day. Sometimes it might mean that a student comes in late because they have a hard time getting up in the morning, or maybe by lunchtime they're done for the day, and sometimes that change could mean that they're going to go ahead and leave after lunch. A placement can also be a combination of placements. You know, you might have a kiddo who really does well in band or orchestra or choir, or really wants to take a particular class in math or something that's really a success and a strength for them. They can go to their regular school for one class or for that choir practice, and then move to their separate facility. So you can really customize a non-traditional placement to whatever you want it to be. And I want us to also think about using that when we move a kid back into a less restrictive environment. So when you're transitioning the student home from a residential placement, or you're transferring them out of a separate facility, you can do a combination of, you know, allowing them to come back and check in, or maybe 2 days a week at their new school and 3 days a week at their facility that's providing them more therapeutic supports, or any combination of whatever works for a student is really what the IEP team needs to do. And this is just a way, I guess, of getting you to think outside of the box, that it's not an all or nothing. It could be a combination of whatever is needed for a student. Well, Carol, I think that's it, but one more slide there. Thank you very much.
Thank